pretty puppy. Who's a pretty puppy? Yeah, that's right.
A good girl. Thank you. Thank you for all those kisses.
I think my dog thought I was talking to her. Sorry.
Hi, good afternoon, folks. We're waiting for a few more people to connect their audio. So I see a lot of people popping up on the screen, and I'm really happy that you are here today. If you have the ability to turn on your video cameras, please turn on your video cameras. We like to see the people that we're interacting with, and you can say hi to my doggie. So she just popped up on my lap. We've been doing a lot of this lately. I want to remind folks that on Wednesday, we had part 1 of the beginner introduction to this class. And if you've had the opportunity to see the posting that I made of the recording, I hope you have, because that will certainly help you understand a little bit as we're going forward. So I'm glad that everybody's here. You're all on mute at this time. If you would like to say anything or need to talk to us about anything, we want you to feel free. We want free-flowing conversation to happen during the course of this class. We've had some really great input and great sessions, so I'm glad you're here. I'm glad you're going to be with us for a few hours, and I'm going to turn this over to Bob now. Thank you.
Hello again, everybody. Good to have you back today. I do recognize most of you that I can see. Just like Valerie was saying, please enable your video if you possibly can. That's especially important today because we are going to be doing some face-to-face work in individual conversations. If you were not able to see this is part 2, if you were not able to see part 1, then probably you should duck out at this point and just plan to do both of them, watching them online on at another time, just because this is building on what we did on Wednesday, and you're not going to really have the orientation to do what we're looking for you to do with the practice piece. But hopefully for most of you, or all of you, you were able to either look at that or be with us on Wednesday, and so we should be in good shape to move ahead. As before, this is very, very casual. At any point, unmute yourself, ask questions, make comments, let me know there's something stuck in my teeth, my tie is crooked, etc. You know, the important things need to be done. And if that's about my hygiene, then that's about my hygiene. I can take it. Today we'll be working, again, basing on what we did on Wednesday, but adding to that and getting into what are the skills, and then how do we use them in conversation. We're going to assess a conversation of motivational interviewing, and then we're going to have practice conversations with motivational interviewing. And that is where the fun comes in. If you think I'm just being euphemistic with you, it actually is a pretty enjoyable experience. So I encourage you to look forward to that. I see that a couple folks are having some technical difficulties. Just work with that as well as you can. Raquel there, okay. So you can see and hear. That's the important thing. We want to be able to see you, but if you can see and hear, that's at least a starting point. And we will go on from there. All right, so a couple things you'll need for today. Pardon me, wants to say thinking caps on? No. Two documents we'll take a look at, and one is the ORS snippet, and this is one that was sent out to you when you registered for this training. And if you have the chance to open it up, you'll notice it's just kind of 8 identical blocks of motivational interviewing skills terms. If you've got that available, please have it easily in reach so you can open it up. We're not going to work with it right away, but we will be getting to it. And the second thing you'll need is the health self-assessment scales. So that at any point, if you want to take that and open it up and just have a look at that, I encourage you to do that. We'll take a look at that a little bit later on as well. So I'm going to dive right in, going to pop into the slides. Let me just get those ready to go. All right, so if I've done my job well, and goodness knows you've known me long enough to know that's a kind of hit or miss proposition, then you should have up on your screen a slide reading motivational interviewing skills. Is that about right? Yep, get a good view of that, unimpeded, excellent, fantastic. So we'll start with that, we'll go on. There are about half a dozen or so ways to conceptualize the skills of motivational interviewing. There's really no like one way that happens. The one that most people who know MI are most familiar with is the ORS method. And there are others too. The ORS is not my favorite because I don't think it's as nuanced or as complete in the way of capturing all of the elements of good motivational interviewing practice, but it's pretty easy to learn, and it comes pretty close to doing what, the things that we need it to do. So it's probably the one I use most often. If I'm doing this as a graduate class, which actually I'm starting that next weekend down at Salve for a summer session, I don't use the ORS method. My students never see the ORS method. We use a much more elaborate coding approach, and they end up having to read and practically memorize a 42-page manual in order to do that. I figured, time's a little tight for us for that. And so we'll do the ORS because it's simpler to kind of go through. So we will be talking today about open questions, affirmations, reflections, and summaries, or reflective listening and summaries. And then we'll be spending a little bit of time on a process that uses mostly open questions and reflective listening that we typically use to either give information or give advice. You'll remember that on Wednesday, I had a lot to say about being careful, holding back on information and advice, avoiding the indulging of the writing reflex, and trying to draw from the person rather than tell to the person. But at the same time, we're also experts too, and sometimes we have ideas and information that may be useful to the person. We don't want to withhold that, but we want to introduce it or offer it in a way that's most likely to be accessible to the person, and also least likely to engender a reaction against what we're offering. Because we all know, if you're too pushy with your information or advice, the person's tendency is to push back. And once we're in that dynamic, it's not going to lead us anywhere productive. So I'll unpack that a lot more, and we'll spend some time with that when we get to it. But we're going to begin actually with reflection. I'm not going to take these in order. We're going to reorder them a little bit and start with reflection. And for that, I need to start with this person here. Anybody recognize this sculpture? Occasionally folks do. Oh, it looks like Carol does. Carol, would you unmute and share with us your...
It looks like David.
It does look like David, yes.
Michelangelo's David.
That is exactly what it is. The sculpture of Michelangelo's David. Thank you, Carol. And from there, I want to share with you a bit of the history of Michelangelo's David. And there's a point to this. I'll come back around to it. Trust me on this. So early 1500s, right? Europe is going through what we retrospectively call the Renaissance. And a lot of the action is on the Italian peninsula. Now, of course, it's not Italy exactly, because there is no Italy yet. The Italian modern nation state established itself, I think, several hundred years later. But 1500s, the cities, the big ones that were there still are, or are there still were, no, were there still are, and they are the operators, they are the players in this saga in the Italian Renaissance, because they're in competition with each other. Each of them are independent, have their own economies, and are competing against the others in commerce and education and arts and that sort of thing. And because the Renaissance is popping, they're all clambering over each other to try to be the best, like the most avant-garde art, the best artists, the best architecture, the best literature, the best poet. The epicenter of the movement is kind of what each of them wants to be. So you've got Rome working against Florence, working against Padua, working against Verona, and Genoa, and Naples, and Venice, and they're all sort of like in this rat race to be the shining star in the peninsula. And Florence is one of the big contenders. So what the city council in Florence decides that they want to do is they say, okay, here's what we'll do. We're going to commission a series of 12 sculptures of biblical heroes, and we'll place them around the city and create kind of a walking tour, and tourists will come and they'll walk the city, they'll spend their money, and then all boats rise, our reputation rises, and that's going to be just part of what we're doing. It's going to be kind of icing on the cake for us. So they got these huge blocks of marble and bring them in. They're all in this courtyard, and they start putting the contracts out for bid. They know who they want, what the sculptures should be of, and then the different sculptors come in and bid on them. And 11 of the 12 go. The 12th doesn't. The 12th is the commission for David. And it just sits there. The block is just there in the courtyard. And sculptor after sculptor comes in, looks at it and says, no. And that's the end of it. So the city council, after a while, is like, project's falling behind. We can't get anyone to take the David block. What's the problem? So they start asking the sculptors, why won't you bid on the job? And the sculptors say, that there's a problem with the marble. This block has a flaw, and you could work on this for 3 years, be almost done, one wrong tap of the chisel, whole thing falls in half. And then what do you got? Nothing. You just wasted 3 years of your life. And they're like, oh, okay, well, kind of too late to get another block. It took us forever to get those. We've got to figure something else out here. And then one of them comes up with an idea and says the others, Leonardo da Vinci is from Florence. He lives in Venice right now. But if we sent him a letter and said, hey, come on, man, one for the home team here, maybe he would come and help us out. So they send a letter off to da Vinci. So they're waiting for that. And while they're waiting, this 26-year-old sculptor comes into the town council meeting and says, I want the commission on David. And they say, well, kid, I don't know if you know this, but a lot of other sculptors have looked at the job and they're saying there's a flaw in the marble. There's a big risk that it's all going to come to nothing. Why should we give you the commission on David? And the kid says, in words that have been passed down through those generations since then, he says, I look at the block and I can see David within. And all I need do is chip away all that is not him, and he will emerge. And the council is like, it's a good answer. All right, yeah, okay, you got it, man. That's what the artist is supposed to say. So he got the commission, steps up, signs Michelangelo on the dotted line, and he's off. Works for 3 years. The block stayed intact, and the result was this sculpture, which you only see the top of, but it's a 17-foot tall nude sculpture of David as obviously a young man, you can tell from his face. And when it was unveiled, his contemporaries, artists and sculptors, came up to him and said, Michelangelo, you have done what we were all striving to do. You have perfectly recreated the ancient Greco-Roman style of sculpture. And if you look at the curls of David's hair and the details of his eyes and his ears, and you get a sense of, and the fingernails, you get a sense of just how meticulous this work must have been. And so it was instantly famous and made Michelangelo instantly famous. And his fame took off from there. He did the ceiling of the Sistine Chapel, etc. So, can you, when you're ready, unmute yourself and just tell me one or two of the things that I've just told you about Michelangelo's David.
So what has struck me is that he was able to, when he said, I'm just going to, I don't remember exactly your same words, but I'm going to put aside whatever is not him, and I'm gonna so him. So it made me think back as our labor of as a counselor, that we're not changing anyone. We're just a tool or a way to have this person flourish and be the best version of themselves.
That's fascinating. And is that Raquel?
Yes.
Yeah, thank you for that. So you've not only given back to me some of the information that I gave you, specifically that his idea was to chip away everything that was not David, but you're also drawing kind of almost a moral or an interpretation or something more complex about what this can mean for us as people who help others. That's very, very fascinating. Thank you.
Thank you.
Can anyone else just share a piece of information that I told you? Anything at all?
I could tell you something.
All right.
You said that there was a young man who walked in and he seemed to be pretty sure of himself and wanted to take on this task. That was one of the things you told us about this statue. Is that correct?
That is correct. Thank you. What else did you hear me say about David?
I heard you say that there was a bad part on the marble that they didn't think it would be worth pursuing.
You remember that I mentioned the flaw in the marble. Absolutely.
Yeah.
Absolutely.
The flaw.
So when you can take information that a person has given to you and feed it back to them, we call that simple reflection in motivational interviewing. You are hearing the person's content and reflecting it back. Simply it, just more or less what the person told you. Maybe you use different words, and maybe you use the same words, but what you're giving back to the person is pretty much what they told you. Simple reflection. Very useful in conversation because it does help keep things moving along. And it also tells the speaker, right, me in this case, it tells me certain things about you. So for example, what do I now know about you if you were able to tell me back those things I told you?
That I was listening.
That you were listening, exactly, right? And so that communicates to me, okay, this person is paying attention to me. They can repeat back, they can give back, even in different words, the things that I was saying to them. Simple reflection. So I want to contrast that with something else that we can do with the material. And in fact, Raquel gave us a bit of a preview by offering kind of a moral or a metaphor from what I said. But let me do it this way. Art historians are generally agreed, almost universally, that Michelangelo's intention was to portray David in the moments directly before his battle with Goliath. If you know the account in the Hebrew scriptures or the Old Testament, the story is that David, the shepherd boy, armed only with a sling, went up against this giant warrior from the opposing army, whose name, of course, Goliath. And Goliath was heavily armored, had a huge sword and a spear, and was obviously the favorite in the competition, because David is a young kid at that point. He's a teenager, perhaps, and does not have any background in the military, and is unarmored and holding only a sling. So art historians think this really for a couple of reasons. The big one is the object that you can see that David has between his thumb and forefinger and that goes over his shoulder is a sling. So that's clearly a tie to that battle. And they say, the art historians do, that this moment is to be captured before the battle. The idea is that this was rendering him before the battle because of the facial expression. Art historians say this is not David triumphant. This is David before the outcome is known. And so what I want to ask you to do is take in his facial expression. Imagine that you're there with him. You're standing there on the hillside. He is ready. He's about ready to step down into the valley and meet his enemy. Engage Goliath in a one-on-one battle. And you're standing there with him. And you're looking at him and he's got this expression on his face. I'd like to ask you, what do you think is on David's mind? And when you've got an answer, what is he thinking or what is he feeling? When you have that answer, I'd like you to tell David what you think he's thinking or feeling. So when you're ready, unmute yourself and tell David what you think he's thinking or feeling.
Hi, I can go. I think he looks perplexed, and so David is thinking, how am I going to beat this person?
Okay, he looks perplexed, and you think he's thinking, how am I going to beat this person? So if we're speaking to David, how do we say that? What are the words we use?
So, David, you're wondering how you can win this battle?
Perfect. David, you're wondering how you can win this battle. Or using your first word, David, you're perplexed. Good. What else? Because there's a lot you can possibly see in that face, isn't there?
Sorry.
David, it looks to me as if you're planning your attack.
David, it looks to me as if
accurate?
you're planning your attack. Great. Fantastic.
So I was thinking about something similar. Nate said, it seems that it seems that he's thinking how he's going to approach his enemy or Goliath. So we'll say, David, it seems that you are thinking how to approach Goliath.
So David, you're thinking how you're going to approach this. Yeah. And you're right, similar to what Nate was saying, you're planning out your attack here.
So do I use the verb instead of like saying it seems, it looks, I just go ahead and do kind of like a statement?
Generally speaking, yes, that's how we would do that. I usually coach people away from it seems or it looks like or I feel like or what I'm hearing you say is, and just put it out there as a statement. And we will probably come back around to why that is. Any other emotions that you see in that face or thoughts you see in that face that you might be inclined to point out to David?
Concern.
Concern, yeah. And it's one of the geniuses of Michelangelo's work is there's just, depending on where you look at this face, there's so much there, right? So concern, how would we express that?
David, you're concerned about what's going to happen.
Perfect. David, you're concerned about what's going to happen. And we might dial it up. David, you're scared about what's going to happen. Or David, you're terrified about what's going to happen. Depending on where we think maybe he is. Absolutely. So thank you very much for indulging me on this. All that to say, when we use our guess about what a person's thinking or feeling and put that out there to them as a statement, we call that complex reflection. Differs from simple reflection. In that simple reflection, I am trying to bounce back more or less the person's words, their content. With complex reflection, I'm trying to look at what's under that content and bring that up into the conversation. Whether that's emotional state, whether that's person's unspoken thought, ideas that they might be having, or even just kind of guesses a little along the fringe of where they're at to see where they are. All of that would be complex reflection. And we use complex reflection a little differently than simple reflection. We find it is more effective both at building empathy and also in helping a person move along towards change once we kind of get used to using it that way. And we'll spend a little bit of time with that. Any thoughts or questions on that so far? We are going to be unpacking reflections on the next few slides, so I don't want to kind of get ahead of us, but just want to check in. Is that making sense? Okay. So as we said, guesses. All reflections are effectively guesses. Simple reflections are safe guesses, because if you're using their content, you're going to be very close to their meaning most of the time. Reflections that take some liberties, complex reflections, well, that's going to be a little different. You have more of a chance of being off, but being off can also be advantageous. Reflections are very frequent behaviors for a helper using motivational interviewing. In fact, they are the most frequent thing that you'll find a helper using in a good MI conversation. More often than questions, certainly, and more often than any other single behavior. Generally speaking, we're using them in a few different ways. One is to connect with the person, to communicate that we're listening, to build empathy, and also to enhance change talk that's in the conversation. And here we've got just the differentiation of the two types. Simple, again, staying close to the person's content. Complex reflection is adding meaning or emphasis to the content. So what does that look like in a change conversation? Well, let's say that we are talking to someone about their health behaviors. And the health behavior we'll use would be exercise frequency. Is that fair? Goodness knows, a fair amount of us probably struggle with exercise frequency from time to time. I know I do. So if we are talking to someone, and here's some examples of complex reflections, and we'll just kind of go through them. This list is not meant to be exhaustive. But if we're talking to someone about their exercise frequency, let's say this person says to us, well, I know that it's important for me to exercise more than I do. At this point, I walk my dog, and that's really just about it. And I feel like there are things I wouldn't mind doing, but the problem that I usually have is that there really isn't any exercise that I enjoy or find interesting. I don't mind walking my dog, but I kind of do it because you're supposed to walk your dog. If it wasn't for that, I wouldn't really walk on my own. And honestly, I'm not into the machines, treadmills or whatever. I don't want to join a gym because that's just a waste. And it's really been a struggle for me to try to figure out, how am I gonna accomplish this? So the person says all that, right? So I'm thinking as the helper, I'm like, all right, so what do I reflect here? How do I communicate empathy? How do I help move this along? If I'm going to continue the paragraph, that first option, basically I want to think, okay, they just said all this. What's the next thing they might say? And then I'll say that to them. So maybe I'll say something like, you've really been struggling with this for quite a while, and you're just not able to see a way forward at this point. Now that seems like a natural follow-on to what they were saying, right? And what we tend to find is you say that and the person will go, yeah, and they'll pick it up from there. Yeah, I don't see a way forward. It seems like all the roads are leading backward. They might, and so now you've got this exchange going on. And with continue the paragraph as an intervention, as a reflection, you can kind of just keep doing that. You build on the story, they continue to tell it, you take another step, they take another step, etc. And remember, we talked about, you're kind of painting the mural with them of the big picture of the problem. This is you two painting together. And you're doing a piece of the story, and then that person will add to it, and then you do a bit here, and then they add to that. And if you're a little off, they'll correct you, paint over something you did. That's fine, because it clarifies. But continuing the paragraph is just kind of adding to the narrative. Identifying feeling is a little different. So the same statement by the person, right? That whole paragraph about where they're at. If we wanted to identify the feeling, the question we ask ourselves is, what do I think this emotion is here that the person's experiencing? And then we call it. So Raquel did with David with perplexed, right? So I might say, you're feeling kind of frustrated about this. It really is just led nowhere. So now frustrated, right? We get an emotion word in there, and the person gets to think, am I frustrated? And if they are, they'll be like, yeah, I am. I'm frustrated. And if they're not, they'll be like, no, I'm past frustrated at this point. I'm just done with the whole thing. Or, that either way, that's good. They'll either correct you or they'll own it. And now you change the color a little bit, right? Because the emotion, that's going to add a splash of color to it. And they can either shift the color a little bit one direction or the other, or they could be like, nope, that color goes there. You were right. Overshooting and undershooting are kind of two sides of the same coin. Here, you're typically working with an emotional reflection, an affective or identifying feeling reflection, but you're intensifying it past what you think is probable, or you're downplaying it. So again, same statement by the person. If identifying the feeling, I'm going to say you're frustrated, overshooting would be like, this really gets under your skin, and it's kind of starting to tick you off. Well, okay, is that where the person was? Maybe, but maybe not. If they were, then they're going to be like, yeah, really it is. And then the fact that you were able to connect with them at that emotional level without them really signaling it is going to increase the empathy level of the conversation. Or if you're wide of the mark, which you were kind of aiming wide of the mark, they're going to back off of that. And sometimes that leads in a change direction. So you may get a reaction like, no. It's an irritation, but I'm going to get this. I'm going to figure this out. And now that's ability change talk that we've got in the conversation. So our ears perk up, and then we say something like, so you're confident that you can beat this, right? And see how now all of a sudden we're on the change track, and that's good. Double-sided reflection is just comparing the sustain side. Remember sustain talk from last time versus change talk? It compares the two. 95% of the time it starts with sustain and ends with change. So we might say something like, so you've been really frustrated about the inability to get this rolling. There's a lot of things that you've tried, none of them have really panned out. There's things you've looked at, none of them are appealing. And on the other hand, there's a part of you that really knows, geez, I've got to do this because my health is at stake here, and I've got to really get this like in process somehow. So we've embraced the sustain side and also the change side. And then we ended on change, so they're probably going to pick up with the last thing we said and be like, yeah, I really do have to get this figured out. So we're doing two things kind of at the same time here. One is we're really trying to use complex reflection to deepen the empathic connection we have with the person, because that's a mover by itself. And we're also trying to use complex reflections strategically or tactically to accentuate the change side of the equation moment to moment and help to kind of shift the conversation in a positive direction by building up their confidence or by accenting the benefits that they might see in change. Talk to me about that, because I threw a lot at you right there. Does it make sense? Do you have questions or concerns about any of that at all? Okay.
What if, I'm sorry, I'm slow on the unmute.
We all have those moments.
What if your reflection really angers, upsets, or offends the person you're directing it to?
I'll let you know, Jennifer, when that happens. It hasn't happened yet. And I'll tell you honestly, and I'm not trying to be flippant, that was a worry of mine when I first learned this approach. I'm like, well, it seems rather arrogant, doesn't it? I mean, at the very least, it's presumptuous for me to be stating to a person my guesses about their unspoken, thoughts or emotional experiences. But I find that, or I have found that, when we're doing this the way that we're talking about, when what we're trying to do is understand where the person's coming from, that people get that, and you get a lot of leeway from folks if that's the intention. That people, fundamentally, everyone wants to be understood, right? When you're talking to someone, you're explaining, a problem that you have, you really want them to get it. And so people hear reflections that we offer them, and they understand this is you trying to get it. And so they're inclined to help. And we find that to be broadly true. Exception to that rule, somebody who comes into the conversation already angry, I usually avoid using complex reflections initially until that anger comes down. Because if someone's angry, there's two problems that I have to think about. One is that people who are angry are looking for targets, right? So if you present yourself as a potential target, they're looking for things to kind of, get gripey about. Then you don't want to be that person. And the second thing is people who are angry are not thinking with their frontal lobes to the extent that might be helpful. And they're tending to react out of that. And that means a complex reflection, which they will have to think about in order to process, is going to likely as not just kind of slip by without really landing empathically the way that we want them to. So it would be a bit of a waste of effort in that sense. So
I have one more. Oh, sorry.
Oh, go ahead. I was just going to finish up and say, so in situations where a person comes into the conversation upset, I usually will use simple reflections until they calm down, because simple reflections tend to de-escalate. And then once they're, processing, then I'll move to more complex reflections. But go ahead.
Just so everyone knows, Bob is paying me $20 a question, so you might want to get in on this.
There is a lot of money to be had here.
Right.
And I think that's 60 for you so far, Jennifer, right?
I know. So my style tends to be a lot more intrapersonal than interpersonal.
Sure.
And is there room for that in this, or do you need to be mostly devoid of that in order to be asking these types of questions and having this conversation?
Excellent question. And when you say your style, are you mean that as a therapeutic modality or just as an interpersonal interactional pattern?
I think both. I have a tendency to, if I'm kind of assessing a situation or something an individual might be dealing with, a lot of times I'll approach that by starting, or kind of bringing into the conversation a time where I may have had a similar experience, and this is kind of what I was thinking or what I was feeling, and use that to bridge.
Yeah.
But it sounds like this is very them-centered. You look like, you sound like, yeah.
So excellent point and an important distinction. So thank you, Jennifer, for that. So let me come at that in two senses. The first of which is as a therapeutic style, so those of you that really don't operate in a therapeutic modality, you might want to pay particular attention to this, and therapists too. So let's say I am a therapist. Well, actually, I am a therapist, but let's say I'm operating as a therapist, and it would not be accurate for me to think that I would be choosing between, say, motivational interviewing and doing cognitive behavioral therapy with a person, or doing kind of a peer specialist style self-disclosure interventional pattern with a person, or any other sort of approach. Because this is not so much an either or, because MI is not a therapeutic modality in and of itself, it's just a conversation style. Because of that, you actually don't need to be a therapist or anything like it to use the approach, which is why we tend to teach this approach broadly, because it's just about how you engage with a person, and can be done whether your role with a person is clinical or not, is assessment or not, is education or case management or whatever it is. This is just a style of talking to a person in a way that helps to engage them and helps them feel heard, understood, safe, and able to explore change. So that is one point. And the second is interpersonal versus intrapersonal. Yes, because motivational interviewing is derived from originally Rogers's person-centered therapy, it is kind of radically focused on the other more as opposed to the self. So MI practitioners tend to use, as a rule, less self-disclosure than many other practitioners do, which is not to say that they don't use self-disclosure, because some do. It really is a matter of what your therapeutic approach is, if in fact therapy is what you're doing. And it certainly can be compatible. The way in MI you would do that is kind of similar to the way that we would do the elicit, provide, elicit, or actually ask, offer, ask protocol, which we're going to be talking about a few slides from now. So Jennifer, if I could defer part 2 of my second response to your second question for a few slides, we'll have a little more context on that at the time. Is that fair?
Yes, thank you.
And feel free to ask it again at that point, because that kicks you another $20, right? Jennifer's making bank on this one. Oh, dearie me. Okay, so complex reflection and reflection in general. Rules of thumb, you want to have your reflections kind of brief and to the point. The more you talk is not really the better in this situation. You want to kind of hit with what you want to get across. You don't want to just notice everything they said and summarize it. That's what summaries are for. Reflection is taking out kind of one piece of what they said and putting it out there, or pulling up one piece that's underlying and putting it out there for them to react to. Small brushstroke, if you will. You are trying to voice their perspective and their thoughts and their emotions. And we find that it's not uncommon that people react very positively and intensely to that. That MI practitioners, you may have people, kind of at the close of the conversation thanking you for listening to them, for really hearing what they had to say. Because that's what this model is really focused on. Can you really get that person's perspective and give them reflections that resonate with them? Beautiful moments. Some of you are probably it was one of the Wednesday sessions, I shared a brief story about a woman in an MI training who was practicing with a helper. She was in the speaker role. She was the client, if you will. And at the end of the session, when we kind of reopened the larger discussion, she was a little startled, and she commented that she had forgotten there was anyone else in the room. And that was a kind of a testament to the intensity of that conversation, that she was so enraptured with the empathic exchange she had with the helper, that it was very powerful for her. So that's what you're going for. Can you really connect with this person? And the benchmark for reflections in MI, in terms of how often you use them, twice as many reflections as questions. And that's hard for most people to get to until they do, and then typically they've kind of got it at that point. But training yourself to use reflection in preference to questions most of the time is for a lot of people sort of the first hurdle of this approach. Really kind of either that or the writing reflex, you know, one of those two typically is the tough one. But twice as many reflections as questions. But there's a lot of evidence that says that that seems to be where a lot of the efficacy of this model is. That if it's going to work, it works when that ratio is where it needs to be. So that's reflections as a whole. Any last thoughts or questions on them before we move on to the next skill? All right. So open questions, and probably many people are used to the distinction between open and closed questions. Educators use this a lot, therapists certainly do, but a lot of people in the helping professions know this one. So let me just put it on you. Can anybody unmute yourself and ask me a closed question? Anything at all?
When will you be ready to start working on this?
I think Wednesday at the earliest. But that's great. A question that asks for a time frame or a date would be a closed question. It asks for a narrow piece of information. And that's really the definition. A question that has a narrow response range is a closed question. What's your date of birth is a closed question. Would you like fries with that is a closed question, to which the answer should always be yes. Because
Hey, Bob,
fries are awesome.
Jennifer Durant-Wing again.
Hi.
Hi. So when you're going over this, would it be possible for you to speak to, my caseload is all individuals who are on the autism spectrum
Sure.
without an intellectual disability, and they don't love open questions. And so I'm just wondering maybe what your experience has been with that population in this approach. And now I'll be quiet for at least the next 20 minutes, maybe.
Great. You've been doing so well, though. So absolutely, yes. And we'll cover this in a little more specificity when we get into intermediate motivational interviewing in a few weeks. Talk about the strategies, and we'll talk about adaptations of the model that you would use with various populations you might encounter. But just briefly, sorry?
I said, all right.
Okay, but I can sort of briefly address that if you'll let me defer elaborating on it more for that point. You do want to respect the ease of processing and the other preferences of the individual at all times. There are contraindications for most of the rules of thumb in this approach. And we will get more into that in some detail. If, in fact, open questions are problematic, then, yeah, you'd want to be ginger about that. Or you'd want to phrase your open questions with branches, right? And you know what I mean about that. You can stack sub-questions underneath them or deliver them in a format that might be more friendly. So this person might prefer to do this verbally, but this person might prefer to do this in writing. If they're going to answer an open question, they're fine with it, but they want to be able to use a pen to do that because it helps them to organize their thoughts or whatever. So we are going to be, it's not person-centered counseling if we're not being person-centered. So we want to make sure we're keeping those preferences and needs at the center of our experience with the person, because that's going to communicate value too. That's going to communicate respect and empathy too. So excellent point. And again, we will get into some further detail on that as we get into the intermediate piece. So that was a closed question. Can anybody ask me an open question? I'm not sure if Nate is putting his hand up. You putting your hand
Oh,
up?
sorry. I was.
Oh, good.
No. But how about, could you tell me a bit about your childhood?
I certainly could. Oh, goodness, where could we start there, right? How do you end up like me without a kind of odd childhood? It all begins with Star Trek. So I'll leave off at that point. But seriously, it's amazing how much my childhood ties into the TV show Star Trek.
Yeah, but seriously, you lost me at Star Trek. So
Yeah.
Star Wars all the time.
Okay, so Nate and I are going to stay on the call afterwards and frankly have a knockdown drag out about Star Trek versus Star Wars. Because goodness knows, well, let's just say. That is a great open question. Yes, tell me about your childhood can really encompass a lot of material, can cover a lot of ground. So that's an open question. We want in this approach, for reasons that are probably obvious to you by this point, most of our questions to be open in most situations. Because, right, we want the person painting the picture. Open questions are going to be, involving a lot of brushwork by them in response. Whereas if we ask a lot of closed questions, it's very interesting because they've studied this. They've looked at, okay, different approaches to a consultation, like a primary care consultation, for example, and how do you approach that? If you ask someone more than 3 questions in a row, especially if they're closed questions, what you'll find is in most cases, their talk time, the amount of time that in the conversation that they spend talking versus the professional, the client's talk time decreases as the number of questions increases. And that continues over time. So the more questions we ask, the less verbal response we tend to get to any one question. And what's happening is the person is learning that their role in the conversation is to answer our questions. And so they wait for the question, they answer it, and then they stop. And it's particularly pronounced if the questions are primarily closed, because closed questions are going to be yes, no answers, specific information answers. And so you'll have, do you have any pain? Yes. And then they wait. Well, where do you have the pain? And then the point, and so you end up with this very stilted, potentially at least, conversation. If we can keep the questions open, that helps to counteract that, but the effect is still somewhat there. Reflections work in the opposite direction. The more reflection in the conversation, the more the person's talk time tends to increase. And one of the kind of beautiful things so around intermediate MI, with all the practice that we start to do, or maybe even to advanced MI, you always in a training get someone who says, I've just realized that when I reflect, they talk more than when I ask questions. Yes, that actually is a documented phenomenon, that you start to use reflections to gather information, whereas you used to use questions to do that. So that can be particularly interesting. Yes, State of Massachusetts interviews. I just got an email, not an email, but a chat from Carol. Interviews are not motivational or a question number. Yes. So quick story about that, right? And this was so frustrating earlier in my career. I used to do emergency psychiatric evaluations for the local crisis center down here in New Bedford. And if you've ever done that kind of work, you probably have worked with a packet of papers very close to the one that I had to use for every evaluation. It's 10 pages of questions, because I got to go in there, figure out what this person's diagnosis is, and then get a plan together for where they're going to go from here. All right, so I got to ask a lot of questions. And so I would ask all the questions. They're mostly closed. We get through the evaluation, I go away, I write up the diagnosis, call the insurance, get a plan going on, come back to the person, and the person's looking thoughtful, and they say, we never talked about X. Fill in the blank, whatever it is. And I'll look at them and I'll think to myself, well, that changes everything. And then it'll come out of my mouth, because I can't help it. I'll say to them, why didn't you tell me about X? And what do they say every single time? I saw Barbara mouthing it.
You didn't ask.
You didn't ask me.
You didn't ask me. And originally, like, in the first year, I thought these people are just being smartasses. But then it happened again and again with people who seemed to be otherwise sincere. And I thought to myself, something's going on here. I mean, they're not bringing it up because I'm not asking about it, but I'm moving so briskly through this interview that they really fall in with the idea that their job is just to answer my questions. And so I miss the central piece of this whole thing, and I have to go back and call everybody again. So halfway through my tenure in that role, I learned motivational interviewing. And man, was that the dawn breaking. It completely changed the way I did the work. I became much more reflective, and that never happened again because I was using reflection to get them to talk more, and they were naturally bringing in everything that was important to them because they were directing the conversation. Whereas when I was just trying to check off, the blocks that I had to make sure I got checked off, I was missing the big picture. So yes, a lot of interviews, most forms, if you can imagine a question on a form, it's probably a closed question. That tends to be true of forms. Excuse me. Excellent point, and thank you for that. So that's questions. What would questions in MI sound like? Well, these are fantastic. I mean, I'd recommend them. As you look through them, you might kind of notice that most of these questions would tend to draw change talk, right, in a conversation. And that's a lot of what we're trying to do. In fact, if you do decide to go on with this, if you do the intermediate, that would be certainly a great start. But it would be just the early part of the trek up Mount Everest. One thing that you'll kind of pick up over time is that in MI, the biggest use of questions is really just about evoking change talk. That's the primary question use in motivational interviewing. Not so much gathering information, because once we're developing skills with it, we'll start to use reflection to do that instead, because frankly, it works better. As weird as that seems, because we're just so used to thinking of questions as an information gathering tool. But we find reflections are actually a lot of times more effective. If you need specific information, questions every time. That's your tool. But if you're looking to have the person elaborate on what their situation is, reflections hands down. So these are great open questions. Any questions about questions before we move on?
Yes, I have a question.
Okay.
So my question is, so how do you get to manage completing the forms with the closed questions and using reflections in the process, given the fact that if you are a practitioner, you have X amount of time to do the application or the assessment and turn in your paperwork, because that's important to the employer, but then you also have to juggle what's important to you, doing what you have to do with the client.
Absolutely. How do you work in, because the work's got to get done, right? And sometimes the work is a form.
Yeah.
And the form's going to have closed questions. So there are more answers to that question than probably there are practitioners in terms of how you approach it. But my rough and ready answer for you there is this. There's an adaptation of motivational interviewing that is called MIA STEP, which is Motivational Interviewing Assessment, Supervisory Tools for Effective Practice. I'm probably butchering that acronym. Developed a concept that they called the MI sandwich. And it basically is a guideline, and it was really designed for case management use. Because case managers, of course, those of you that are, realize that there's a lot of forms involved in this work, and sometimes we need to fill them out with people. So what they did was they set up this model whereby you begin a conversation with motivational interviewing. You use that to engage the person and connect with them. And then at the point, wherever it's appropriate, you ask permission. You say, okay, we have this form that I need to get done. for whatever purpose, or to help you with whatever goal. And it's going to involve me asking you some questions. So if it's okay with you, I'd like to pause our conversation for the moment and have us focus on this form. And then when we're done with that, I'm going to want to wrap up our conversation together. And people are, because you've engaged with them, they're feeling comfortable in the relationship, and they're typically going to be okay with that. You complete the form, and then you end with another MI conversation for whatever breakdown of minutes fits, and you wrap up with a summary at the end of that, and on to the next thing, on to the next person, or the next session that you see them, or whatever. So that's what I guess I would describe that as kind of carving out of the MI conversation a time to do the form. We find that that tends to make people more kind of accepting of some of the tedious necessities of the business that we do, right? Because the forms are not everyone's favorite part. They're not anyone's favorite part. They're not your favorite part. They're not the person's favorite part. But where we're able to kind of do that cooperatively, that often feels better to the person. Does that make sense?
Yes, thank you.
Excellent. Okay, so you see how that would work. So let's move from questions, if we could, over to affirmations. We touched on this concept a little bit when we talked about the spirit on Wednesday. And this, I would argue, this skill is particularly important for populations that have traditionally been marginalized or sidelined, or not really actively engaged in their own care, in terms of decision-making around their own care. If these sound like familiar descriptors of a population that's important to you, then you're probably not alone in that. And that makes it much more important that we are conscientious about using affirmation and using it well, because any of us can just praise a person. And I think we probably all recognize that that's not necessarily valuable, that a person has to themselves value our opinion, value our praise, and be able to take it seriously, by which I mean it's got to be able to fit with their self-image. Because if you, for example, were to praise me on my organizational skills, that would not land well with me in terms of having any validity, because I know myself to be a fundamentally disorganized person. So you want to make sure that your affirmation is congruent to the greatest extent possible with the person's self-image, that at least it refers to a quality or achievement of the person that they are willing to acknowledge, or entertain as a possibility. So by affirmation, we mean that we are going to take specific notice and call out verbally strengths, values, achievements, intentions, worth, efforts of the person. Excuse me, and to do that, we're going to be looking in the conversation for material that can be affirmed, stuff that would make sense for us to call out as a positive and bring to the person's attention. And those would sometimes sound kind of like this. Standing up to her took a lot of courage, or you've really made a strong effort to control your blood sugar, or that's a very creative solution to the problem. So some of these might deal with abilities, or some of these might deal with achievements or qualities or values. But they need to be congruent with the person's self-image. They also have an effect on the person's self-image, right? So if you think back to Wednesday when we were all together, one of the things I asked you to do was to remember a person, right, from your past, a positive change agent, someone who was kind of a mentor for you. And if you think of that person now, if I were to ask you, can you remember anything that that person specifically said to you? Could you maybe even come close to quoting something they said to you at one point? For a lot of you, you could. And there's a high likelihood that what you are remembering is an affirmation, that they said something to you positively, said something positive to you about you, and that's stuck. And that tends to be true of affirmations. If they land well, if the person's able to accept them, they remember them, especially if it's a relationship that's important to them. And through our work with reflection and enhancing the empathy of our connection, we are creating an importance in the relationship. If the person thinks of you as someone who really understands them, which is what complex reflection, well used, will get, then an affirmation that comes from you has the potential to be very sticky in a positive way, and something that could be remembered years later. Think of the beauty of that. That something positive that you put out there that goes into a person's ears gets stuck in their brain and becomes part of their self-image for years to come. Wonderful when we can do that. And hopefully we've had experience where that's happened. We won't usually know, right? Because the person does not typically bring that back to our attention. Sometimes they do. But maybe you've had an experience like that. But the more we can kind of try to do that, the more chance we have of having one of those things stick and become that positive force, or part of the positive force in their minds. The little Jiminy Cricket on the shoulder there that whispers that positive message to them when they need it, you know. Now, one thing we want to be careful about, you don't want to overuse affirmation, because if you overuse it, it tends to lose its power. They should be, you know, less common than questions and reflections. If you're having a 10-minute conversation, 1 or 2, maybe 3 might be, you know, perfectly good. 20-minute conversation, maybe 4 or 5. You don't want to overdo it with these, but a well-delivered affirmation can really have staying power. The research actually indicates these are more powerful than complex reflections when it comes to moving a person towards change. And that's probably because they go to the self-image piece, right? A big barrier to change for a lot of people is the fear of failure. They don't believe that they'll be successful, and affirmations are one of the ways we can try to impact that. So learning to do these well can really pay dividends for helping the people that you work with be successful with their goals. Thoughts or questions on that at all? That seem to ring reasonably true. Yeah. All right.
Would you please repeat the frequency that you generally find best to use it?
And I don't want to give the idea that, okay, you should not use more than 3 in 10 minutes. It's not like that. I'm just trying to give a sense that this should not be a very high frequency behavior, because again, the salience tends to drop if you overdo. But if I'm having a 10-minute conversation, you might hear 1 or 2, maybe 3 affirmations out of me. Some people use them more than I do, and some people use them less. And I don't know that there's really any clear indication as to an ideal number. I think it's really a case by case. I might be more inclined to use them with individuals who I feel like needed them more, you know, right? So let's say I'm talking to someone and they're dealing with a substance use disorder. And the clear message I'm getting from them is, yeah, if they wanted to quit, they're pretty sure they could do it. I mean, it's not a question of that. Because they quit before and they were clean for a while and they said, yeah, I'm just gonna go back to it, you know, because I miss things about it. So it's not about ability for them, it's just about desire. Do they want to be sober? Do they want to reduce their drinking? I would probably, with that person, use fewer affirmations because I'm less concerned with building up their self-confidence. Because that's not where the problem is, right? The problem is they just need to figure out, do they want to do it? And so my weight's going to be more on the side of, all right, let's explore your reasons for change. So I'm going to tend to neglect affirmations. I'll still use them, but I'll use them less. If the person's problem appears to be not that I want to stop drinking, because goodness knows I I'd love to be able to just be sober, but it's got its hooks into me, I just can't get rid of it. There, I'm going to be looking for affirmations. And I'm going to be much more conscientious about trying to find this person's values, positives, qualities, achievements, etc., successes that they've had in the past. Trying to bring that stuff up because I've got to build up their self-efficacy, and affirmations are a way I can do that. So in that case, I'm going to tend to use more affirmation versus the other case where I might use less. So absolutely case by case, but you just don't want it to be a very high frequency behavior. Long answer to a short question. That seems to be a pattern with me, doesn't it? Did that make sense? Did that answer the question adequately? I actually didn't even track who asked it. I'm sorry. I can only see 6 of you at a time. All right, hearing nothing, I shall proceed. Summaries, right? Summaries are exactly what you think they are. They are summaries. If your reflection goes on too long, it probably becomes a summary at some point. If you are covering more of the conversation than just the last thing or two the person said, you're probably in summary territory. And they're useful. They're very useful. Summaries are great for kind of wrapping up a piece of the conversation. So with the alcohol use disorder, we might say, okay, so you've talked about the role that alcohol has had in your life historically, and we've also touched on kind of how it's affecting the relationships that you have in your life at this point. And you mentioned that you had a kind of a brush with the law that was involved with alcohol. What else do we need to know about it? What other areas of your life do you see as being affected here? So I used a summary there, and then I used a what else question to kind of stimulate the person's thinking. And maybe they say, oh yeah, my job. It really does affect my job. And then we kind of go off in that direction. So summaries help to organize information in the conversation. And sometimes for people who tend to kind of be all over the place when they talk, summaries can be really good for kind of roping them back in and kind of giving you a bird's eye view of the conversation. So here's what you've said. What else do we need to kind of check in on? And that can help organize the person in terms of their thinking and make the conversation therefore a little more productive instead of bing, 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 like that. Summaries are also fantastic if you feel like you're at the point of the conversation where this person's really thinking about taking some action on this problem. A summary can be a fabulous way to just bring together all the change talk in the conversation. So with this person, we might say, so you've really been concerned for a while about the way that alcohol is negatively affecting your social life, whereas it was positive, for years. It really has gone downhill. It's really been a damaging factor for a lot of your relationships. You feel like your job is kind of hanging by a thread. You've started to hear legal trouble sort of knocking at your door. And you're really at the point where you're not sure whether this is really worth hanging on to. What do you want to do? Now, see, I use the summary, and then I lead into the decision question. What do you want to do? Or, what's your first step? Or, what are your thoughts? What's the play? Anything that can kind of get the person thinking about what action they might take. That's the transition point from evocation to planning. Now we're going to look at change planning, assuming the person does decide to move in that direction. So summaries can be great for there as well. Love to wrap up a conversation with a summary because it just ties everything together with a nice little bow on the top, metaphorically speaking. So when we get into practice conversations, there'll come a point in your conversation where the timer will pop up, you'll have 60 seconds left. Might be a good time for a summary. You've got a minute, wrap the whole conversation together, and then boom, you're off to the races. So that's summaries. Pretty cut and dry. Any thoughts or questions on those? Okay. So one process piece that I want to get to, and then I think we'll be ready for a break. And from the break, we'll come back, look at some examples, do some assessment, and then we'll be ready for practice conversations. I'm very excited. So process piece, we talked about the importance of holding back on that writing reflex. Do not lead with the information or advice, but you want to have it available. So how do you then bring it into the conversation? Well, step one, you want to draw it from the person if you can. Step two, if you can't, you're going to ask permission to share information or to share advice with the person. And then once you do, you're always going to check back with them to see if they feel like it's applicable to them or what their thoughts are about it. And oftentimes you're going to want to reinforce their freedom of choice in the conversation. So what does that sound like when you're doing it? Well, if we are, for example, let's say the alcohol problem, right? And we just did the summary and then asked the decision question, what do you want to do? And this person says back to us, I don't know. I really don't know what I want to do. Well, now, right, we want to begin to offer some expertise. But I'm going to be cautious. And I'm going to say, well, I mean, when you thought about quitting, when you thought about really, taking a stand and cutting back on this, what ideas have you had about how you might do it? Because I want to make sure they don't have anything for me. Or if they do have something, I want to hear that before I add anything to it. So maybe that they say, well, I think I probably should just get off it entirely. I don't think the halfway measures are really going to be any good for me. I feel like I should just go into a detox. I think that's it. I think I just got to, find a detox bed, go in, do it, go through it, and then kind of take stock from there and come out and just keep fighting the fight one day at a time, right? Okay, so he put all that out to me. He's got those ideas. And I'll say, all right, so you've got the sense that you've got to do this like full on. You've got to be able to just have it be the end of it, clean break, cold turkey, as they say. And then you want to take stock and do things from there. All right. Now, there's other ways people have tried as well, I might say. Would it be okay if I share some of those with you, just for other ideas or other perspectives? Now, people will always answer this question in the affirmative because they're interested and you've asked respectfully. So the person says, okay, sure. And then I might say, so yeah, a lot of people do go the detox route and they have success. And there are also at this point outpatient detox options. Sometimes people do check in and they do the period of time. And sometimes that can be managed on an outpatient basis, sometimes with some medication supporting that to really ease the withdrawal a little bit. A lot of times people have success with that as well, and we can look at some of the success rates if you're interested in that as an option. And recognizing what you said about having to go cold turkey, and that may absolutely be the case for you. There are other folks who have found success through rational recovery and harm reduction approaches, where they control their drinking without eliminating it entirely. And here's a couple of examples of that, I might say. And then I'll summarize together. So we've got with the harm reduction, we've got the outpatient detox, and then we also have your idea of really just going in and getting it done and doing the inpatient detox piece. What do you think? Which of these do you think would be the best one to try? So I've wrapped that together, right? My ideas with theirs, I've summarized, and then I've asked them to determine which of those ideas make sense to them. And then I'll often end with, it's completely up to you. This is your change to make. Because I want the autonomy, I want the power to be on their side of the table. Because that's going to empower them to make that decision. So that's basically how that works. Just an example, and setting aside the validity of the different options in terms of your view. Does that process make sense? Do you see how that would work in conversation? And it's the same process for giving information to you, draw from them. For what do you already know about drinking and its effects on the body? Just as an example. And then you get their information, you ask permission to add, you add your stuff together with theirs, and then you're back to, does that make sense to you? I mean, ultimately it's up to you to kind of assimilate this information and decide if you want to do anything about it. Puts the power back on them again. So that's the process. Because we do have, expertise. We are professionals, right? And so there are things we can contribute that can be helpful. we want to do it in a way that does not have much of a chance of exciting pushback from the person. Because once you're in that, resistance situation, it does not tend to go in good directions. This has very, very minimal risk of pushback because we're asking permission, right? Because we're drawing from them first, because we're deferring to them afterwards. So they're in control the entire time. Any thoughts or questions on that? Okay. Well, we're zipping right along. So we're about 20 after at the moment, right? And this would be a good point for a natural break, because when we come back, we can just take a look at the assessment instrument and then look at a conversational example. And then we're ready to get into conversation proper with each other. Does that make sense? Yeah. All right, so why don't we take a 10 at this point? I will pop the clock back up. So I will stop sharing that and I will start sharing this. So you should be able to see that 10-minute timer on there, just like you did a couple days ago. That's counting down. It'll chime on against the 10. Enjoy your 10-minute break and I'll see you shortly. Everybody? Welcome back. I do want to check in on a question that Jennifer had asked to me directly in the chat. She wanted to know if we were going to be talking at all about the stages of change model and its influence on motivational interviewing. And the quick answer on that is it is not typically something that I do unless somebody asks about it specifically, which in fairness you just did. So I'm open to that. Because that's the trigger. Does somebody ask about the stages of change model? And if they do, then I do mention. If they don't, then I don't. Are folks familiar with stages of change as a model? Give me a head nod or a head shake if you. Okay, so Heather's kind of back and forth there, like so sort of. So you know a few folks. So the 2-minute version of that is that Prochaska and DiClemente, two theorists in the late 80s, early 1990s, who were specialists in substance use disorders, established a model called the stages of change, in which they pontificated that a person who is struggling with a particular issue is in one of several stages of change. People who are what they called pre-contemplative, which is a word you might hear a lot, are not even thinking about changing. They're not engaged with a pre-contemplative, right? Before they're thinking about it. So this person is not even acknowledging that there's a problem, most likely, and they make it defensive if you suggest it's a problem. But they're not going to change anytime soon, by all accounts. Contemplative is the next step up. This person is thinking, all right, now this is a problem, and at some point I probably should do something about it, but maybe not now. Very ambivalent about it. Preparation is the next step, where the person is really looking at actually making a change. And then action is the step after that. They're actually making the change. And then maintenance is the step after that, where they're maintaining that change. And then after that, the step is relapse. So people do not always go to that last step, right? They don't always go to any of the steps. But if they go to that last step, that they then tend to pop back into one of the previous steps. It could be back all the way to pre-contemplative, or they could just go back to action. So we call that a slip, in substance use. So stages of change as a model and motivational interviewing as a conversational approach both arose about the same time. And they were very compatible with each other, because you could use MI to work with someone who's ambivalent and help them move through the stages, right? There's no actual relationship between the two. They were not connected in any way, except that they evolved around the same time. And many substance use practitioners like the stages of change model and also liked motivational interviewing, and so would kind of think of them together. DiClemente, who is half of the team that developed the model, actually wrote a chapter in the second book, Motivational Interviewing, Helping People Change. And his chapter was on, given the stages of change, what are the best MI strategies for the different stages. If you have someone who's pre-contemplative, what do you do? Which MI skills and which MI techniques and strategies do you employ? If they're contemplative, what do you do? So interesting, but I don't usually do much with it, partly because of time, and partly because fundamentally, people are ambivalent. And they might be more on the sustain side or more towards the change side, but our approach is really not going to be that much different. It's going to be engaging and listening and helping them to talk things out and paint the picture for themselves, and kind of subtly nudging the change side into a little more action as we go. And if they're pre-contemplative, that's going to take longer. And if they're in preparation, it's not going to take as long. But kind of isolating which stage they're in might be helpful, but probably not to the extent that we need to use a whole lot of time thinking about it. So I tend not to do much with stages of change. If you like it, if it helps you, fantastic. I'm all in favor of it. But it's not something that that I find is essential. So where there's limited time, particularly, I tend not to spend much on it. But excellent question, because it does come up a lot. People associate stages of change with MI. And there are actually several MI adaptations that kind of bring it in specifically. Motivational enhancement therapy, for example, does that. Did that answer the question adequately, Jennifer?
It did. That's great. Thank you.
Fantastic. Thank you. All right, so we're after the break. We've got about an hour and 25 minutes left in the day. And things are going to get a little more active from here. So the first thing we're going to do is take a look at the assessment tool that we're going to be using to evaluate both Terry Moyers in her video and then each other in our conversations and our use of motivational interviewing. So the aforementioned ORS snippet, if you could bring that up to your screen so that you can get a good look at it. I'm going to share mine. All right. Oh, see, I was actually coding a conversation in the last session, so I'm going to erase my results here. Okay, so yours probably looks like this, although I've zoomed mine in just to be on the top left-hand, sorry, top right, yeah, no, left, top left-hand corner of it. I've always struggled with right and left ever since I was a child. I don't know why, I can't seem to get the hang of it. Upper left-hand corner, because you only use one block at a time. I just have it set up this way because usually I use this as a printed resource, so I double-side it and then cut it in fourths, and that way you've got, you know, every quarter of slip of paper, you got 2 OR sheets, 1 on each side. Excuse me. So if I'm listening to a conversation, I am going to have a pen in hand or this up on a keyboard, and I'm going to be looking for what is the helper doing. So let's think about the conversation that we had on Wednesday with Terry Moyers, right, talking to Richard the smoker. And she says to him at first, Richard, you've agreed to come in today and talk to me about your smoking. Could you tell me a little bit about that? And that would be an open question. So I put a little mark next to the O across from questions because I'm counting, right? The left column are the behaviors that I'm tracking, and the right column are the counts for those behaviors, interventions, number of times used. So one open question, I put a mark next to the O. If it was a closed question, the mark would be next to the C. If it was an affirmation, it'd be one line below that under affirmations. But that's what she did, open question, so I put a mark there. And he starts talking about his smoking, about how he would light up right now if he could. And she says, so being in front of the camera makes you want a cigarette. Well, that's a complex reflection because she is extrapolating from what he said. He didn't mention the camera. He just said he would light up right now if he could. So she makes the association, oh, being in front of the camera makes you want a cigarette. Complex reflection. He corrects her and says, actually, my whole life is based around a cigarette. I get in my car, I smoke a cigarette. I finish with a client, I smoke a cigarette. I finish my dinner, I smoke a cigarette. And then he talks more about that. And then she says, it's that much a part of your life that you would have one even right now. Well, that I'm going to say is a simple reflection because it's more or less what he said, very close to his content. And then he talks some more about his smoking. And then she says, there's a part of you that really enjoys smoking. complex reflection, I would say, because she says there's a part of you, which is not what he said. She's kind of saying that there's another part, but this part of him really enjoys smoking. So there, she's extrapolating again from what he said. She's going to underlying meaning, and then he responds to that, and then there's another part that says you really don't want to. And that's how this goes, that through the conversation, we are tracking, using this sheet, what she does. We're not really paying that much attention to what he does. We're focused on the helper. And at the end of this conversation, this then gives us a way to give her feedback, right? And so that's what we'll be doing with it. We're going to first use it to assess the conversation that Terry has with Richard. We're going to listen to more of that conversation. I'm going to invite you to code her, because that's what this is called, coding, to code her along with me, and we'll go through the conversation, kind of see where that takes us. And then we'll be ready to break up into groups ourselves and use this to rate each other as we practice motivational interviewing. Any thoughts or questions on that? Is that making sense? Okay. So what I'll do is I am going to, let's see, pull up the conversation. So this is the point at which, let's see, I'm going to stop share, reshare, screen one. So you should be able to see Terry and the coding sheet at the same time. Is that right? No, okay, good. So this is the point at which she says,
smoking.
Right. Yeah, there's a part of you that really enjoys smoking. Now he's going to talk about there's a part that says you really don't want to. So if you would, let's just assume that I'm right about the coding. If you want to put a mark of your choice next to the open question on your coding sheet, and then 1 for the simple reflection, and then 2 for complex reflections, that'll get us caught up with each other. And then we can move ahead and listen to the conversation. So if you're ready, I'm going to hit play, and then we'll code this live as we go.
And then there's a part that says you really don't want to, or you shouldn't. And it has nothing to do with people saying you can't. It's the fact that after a period of time, you start the flavor, the taste, the problems, that becomes an issue.
Mm-hmm. On the one hand, you really like it, and it's good for you, helps you. And on the other hand, you're noticing some things you don't like about it.
Right.
Like you have to go out at night and get it, you have to look for a break. And then there's also something about the flavor and the taste you said.
So quick aside, right? Double-sided reflection, so complex. And also notice that she begins on the sustained side. So you really like it, it's good for you, it helps you, and then goes to the change side. And on the other hand, you're noticing things you really don't like about it. And she ends on those negatives of smoking. And then he's likely to pick it up from where she leaves off.
Yeah, you just get to a point where it's not enjoyable anymore. You're just doing it strictly out of habit, probably because of the nicotine that you want. But it's really not it's really not because you want it, because it gets to a point where you have to have it. And I've never tried to quit. I mean, I've been smoking for a long time. Never once said, you know what, I'm going to quit smoking.
And why is that, do you think?
I think it becomes a way, so much a part of your life. It becomes what you do. It's everything that you are. If you go fishing, you go hunting, you go to sporting events, everything you do, that cigarette becomes part of who you are. Even to a point where you can't imagine yourself looking in the mirror without holding a cigarette. It is part of who your character is, even.
So cigarettes are now a part of your character.
Absolutely, it becomes part of your character. I've had people tell me they can't even imagine me without a cigarette. Can't imagine what I'd look like without a cigarette.
And you can't even imagine yourself without a cigarette.
No, so it becomes who you are. But at the same time, some things are happening. One is, that the taste isn't there anymore. The cost is getting really, really high. So now you're finding yourself going to these lesser brands or making this run to the res so you can bypass. You have to do so much to smoke a cigarette and to maintain that desire that it gets really ridiculous, quite frankly.
Smoking used to be carefree for you, but now it's actually causing you a lot of trouble.
It's a challenge now. It's not just go get a pack of cigarettes. It's now how much do they cost? Which one are the cheaper ones? Did you pick up a carton at the reservation because it's so much cheaper with no taxes? Did you burn that hole in your clothes? Oh my God, that shirt had burned a hole. I mean, you start running into more and more issues. Then you start wondering, what's the return of this? I mean, what is the value?
Yeah, I was just going to ask you about that because you mentioned earlier sort of you're smoking more and enjoying it less. And not only that, but then here come all of these sort of burdens or costs.
It'd be a terrible smoke commercial. It'd be a terrible commercial.
It's almost like if you were trying to convince yourself to smoke, you'd have a hard time doing it.
It would be like the old saying, smoke less and enjoy more, but it's the opposite. Smoke more and enjoy less. So it would be a terrible, terrible advertising campaign. Yeah, you just to the point where you finally decide to yourself, you know, somewhere along the line, you know in the back of your mind, somewhere in the back of your mind, you're saying, you know, there's going to come a time when I'm going to put these down.
You're thinking about it.
Absolutely, because of the involvement, how much its involvement is to smoke. It's too much. And besides the fact that it's even considered socially unfair, or socially, whether you want to consider it fair or unfair, unacceptable in so many arenas. People go out of their way to make an example by saying, oh my God, he's smoking. Could you move that way? People become very rude with it. Yet, at the same time, it's sort of a two-edged sword. You have the one side that says, don't smoke, and then the other side says, keep smoking because we're going to use it for healthcare. You know, it's sort of a bizarre. So in your mind, you're going, what is this? The smoker looks at this in a whole different way than the non-smoker.
Well, it sounds like every time you try to think about one side of it, you have to end up thinking about the other side of it.
Yeah, it's just it's conversation in your mind. Mm-hmm.
So let me just pause there, check in with you folks. Tell me what you're seeing so far. What do you notice? Any thoughts, any questions, either on the coding or the conversation itself?
I noticed that he started making his own double-sided comments.
Yeah, he's actually doing his own double-sided reflections now, isn't he? He's got that kind of dichotomy going on. And that's kind of what ambivalence sounds like, isn't it? He knows the benefits to himself that he experiences, and he's acknowledging all these drawbacks too. That's kind of the reality of a smoker's situation. Excellent. Anything else? Any other impressions at this point?
I was finding it a little difficult to tell the difference between a complex and a simple reflection.
I imagine you're probably not alone in that. Yeah, I'm seeing some nodding on that. So yeah, I belong to a coding lab, right? There are about 6 or 7 people from all over. One of us is in California, one of us is in Minnesota, one's in Puerto Rico, one's in Holyoke, Massachusetts, and there's another one in Portland, Maine. And we all get together on Zoom once a month. And what we do is we're all professional coders. We listen to or look at some MI in process, we code it, and then we spend the rest of the hour bickering with each other about why that was simple and not complex, or why that was an affirmation and not a complex reflection. And we find it a lot of fun, which I recognize is terribly, terribly sad. But that's kind of how we entertain ourselves. So there's a lot of subjectivity. And one of the areas that is most subjective is the defining line between simple and complex reflection. On paper, it looks pretty simple. If what Terry says is pretty close to what Richard said, then we're going to code it as simple. But if she does something different with it, if she, kind of juxtaposes the two sides of the ambivalence against each other, for example, or if she extrapolates from it or says, draws an analogy from it, like, so you're sort of smoking more and enjoying it less, then those things tend to make it complex because she's adding to his content. She's doing something different with his content. A lot of times you can tell to some extent by the reaction. When she said the smoking more, enjoying it less piece, he stopped and he started laughing, right? So obviously, what she said is not what he just said, because he would not have laughed at his own comment, read back to him. So he sees that as new, novel, a different way of seeing it that struck him as funny. So he gives you a bit of a clue there. All right, that's going to land as a complex reflection because she has done something with his material that has made it different. And then he reacts to that. Does that make sense?
I think I was having a little bit of trouble just because of like when he was making the double-sided comments and then she would say it back. I thought that might be a simple reflection.
Because it sounded pretty similar. Yeah.
Yeah, it might not have been exactly though what he said.
Yeah, and that's possible. Now here you put your finger on a bit of a and that was Lacey, right? Yeah. You put your finger on a bit of a fine line. The double-sided reflection is one of the kind of categories of complex reflection. So for most coders, you almost reflexively code a double-sided reflection as complex. And so I've sometimes asked the question, well, what if the person says something double-sided and you repeat it word for word? That's got to be a simple reflection. And most coders would be like, all right, that would be a simple reflection. But the double-sided reflection is kind of complex by default because it focuses the person's attention on the ambivalence. And that's a motivator. That's that's going to generally help them want to move off of the ambivalence, and that's often going to be in a changed direction. So the logic may not be completely solid there, but we tend to give double-sided reflections the benefit of the doubt. And they get coded as complex maybe a little more often than they should. But I don't think we have really great research to say that shouldn't be the case. So that's kind of the default that most coders operate by. But good pickup there, Lacey. Double-sided sometimes get a little more of a pass than other reflections do in terms of complexity. So think about affective reflections. If Richard had said, people get really rude about my smoking, and they tell me, to move away if I'm smoking, near them, and sometimes it kind of ticks me off. And Terry had responded, you really find that irritating. So that's an affective reflection, but irritated and ticked off are really not dissimilar enough that we would code that as complex. So we would probably code that as simple. Even though it fits the category, the bar is a little higher. Double-sided reflections usually will get a pass because MI has such a value for focusing on the ambivalence. So that tends to kind of, give us a little bit of a tendency to grade those as complex. Does that make sense? Or does it make sense for not making sense? All right, so let's move ahead a bit, code a bit more of it, see where that goes.
Not as free as the early days when you went down and got a pack for 25 cents. For God's sake, you would go into a building and they would have a cigarette machine. You put a quarter in, didn't matter how old you were, and pull the lever, pull out your cigarette. And you smoked, and no one thought much of it. I can remember smoking in the theater, smoking on an airplane, smoking in your job, smoking all the time whenever you want to. It's just considered a norm.
Right. You didn't used to think about it very much, and now you're thinking about it all the time.
Now it becomes an issue because it's not enjoyable in many, many areas of the smoking experience. It's not just the smoke, the flavor, it's the social norm, it's what it costs you to buy them, what's all involved. And then, of course, the issue of health, which is the older you get, you begin to realize that it's starting to affect you. And every time I go to the doctor, he says, oh, by the way, have you thought about quitting smoking? You ought to be considering that. So you're constantly having this little, and friends and relatives and people that don't smoke say, I quit 10 years ago. You might want to consider it. It changed my life. Food tastes better. All that good stuff. You're hearing all this positives when you're dealing with all these negatives.
Let me see if I just can see what you've just said. One is you're worried about your health.
Oh, sure.
Every time you go to the doctor says something.
Sure.
Second of all, you're thinking about the social stigma that people are always sort of looking down on you because you're a smoker and saying something like, have you thought about smoking? You should stop smoking, right?
Yeah, you have a lot of things coming negative more than a positive. When I first started years and years ago, smoking was considered a positive thing, not a negative. I'd rather fight the switch with Territon, enter into the cool country with Salem. I mean, everything was built around the advertising campaign to make you feel as though it was okay. And then, of course, your friends did it. And it was part of that passage of, you know, from being a child into an adult, when a guy would have a cigarette. And if you were really good, you rolled your own, and you were just really macho. And then you had the Marlboro guy, and all the guys wanted to look like that really pure type person. So yeah, from that standpoint, you saw the positives. Today you see the negatives, and you hear the negatives.
You're seeing the negatives.
Absolutely.
And you've thought about quitting.
Yes, it's entered my mind many times in the last year or so.
And what do you think has kept you from trying? Because it sounds like you're thinking hard about quitting and experiencing a lot of negatives.
I think there's two things. One is it's become such a normal thing for you. Imagine yourself not having one, getting in the car, because everything you do is circled around that. So you get in the car and you smoke a cigarette. Then you light up as soon as you get in the car, as soon as you walk out of a building, as soon as you get out of your office, as soon as you finish with a client, and as soon as you finish eating dinner. I mean,
is it kind of like this, like you just can't even imagine what it would be like not to have a cigarette?
Cannot even imagine being without a cigarette.
You can't even imagine it.
No. Truthful.
When you think about your life without cigarettes, it's just a big blank.
Yeah, it's just bizarre. What am I going to do?
Okay, so that's one thing. Like,
yeah, that's one thing. But
it's like jumping off the edge of a cliff and you can't even see where you're going.
Very true. Then the second part of it, of course, I think without question, is that fear of what you're going to go through when you.
So just a couple right there. She says, you can't even imagine yourself without a cigarette. And he says, yeah, I can't even imagine it. And she repeats that, so simple reflection. And then she says, you think about your life without cigarettes and it's just a big blank. So to me, that's a metaphor. You know, that's a picture that she's painting for him there. And so that for me is complex. He acknowledges that, and then she throws one more metaphor out there. It's like you're jumping off the edge of a cliff and you can't even see where you're going. I mean, not that you would want to jump off the edge of a cliff if you could see where you're going. I'm not sure what she was really meaning there, but you get the idea. It's a metaphor, complex reflection. Any thoughts or questions on any of that or up to this point? You kind of see how this is working?
So if you ask a question that essentially is rhetorical, that counts more as a reflection?
There's been a couple of examples. Let me actually bounce back slightly here and see if I can capture the one she just did.
Did you finish eating dinner?
So is it kind of like this, like you just can't even imagine what it would be like not having a cigarette?
So she says, is it kind of like this? You can't even imagine what it would be like not having a cigarette. I coded that as a closed question. Is it like this? You can't even imagine what it would be like without a cigarette. So I said, closed question. Is it like this? Okay, closed question. And then he says,
even imagine being without a cigarette.
Can't even imagine. And she says,
can't even imagine it.
Can't even imagine it. So simple reflection.
No. Truthful.
When you think about your life without cigarettes, it's just a big blank.
Complex reflection because of the metaphor.
Okay, so that's one thing. Like,
yeah, that's one thing. But
that's like jumping off the edge of a cliff and you can't even see where you're going.
Complex reflection for the metaphor again. So yeah, the question part of that, it maybe was a little bit rhetorical, but to me it was enough of a question being asked to him that I did code it as a question. There are though. So let's say someone, the alcohol example before, and we're talking about his alcohol use. And I say back to him as a reflection, I say, so you really find yourself asking, geez, am I really doing the right thing here? Now that's a reflection because I'm saying this is what you're thinking to yourself. You're asking yourself this question. I'm not asking him the question. I'm saying this is what you're asking to yourself. So we would code that as a reflection. That can get a little confusing. But the idea is if I'm asking him a question, then I'm going to code that as a question. If I'm including kind of a question he might be asking himself in a reflection, then we wouldn't code that separately as a question because I'm not really asking him. I'm just saying, here's what you're thinking, which is a reflection. Did that make sense, or was that just totally more confusing than you were before?
No, I can see where it would take some time and practice to be able to code accurately, kind of given some of those kind of finer distinctions. But no, I get it. Thank you.
So when we're training people to be coders in the sense that we want to have them do that professionally with our team, for example, they start with the 2-day training, just to give you a sense. And the 2-day training has nothing to do with MI. It's just the coding of MI. So I work with a coder who is a great coder and never learned MI. She just knows how to code it. She can't do it. So that's her function. She operates as a coder for our team, but is not a practitioner herself, is not someone who uses the model, just a coder. And there are people who do that. And some people who do it very, very well. It actually can be a side gig for folks. I mean, it is for me. But that's all another question. Excellent point, excellent question. How are people feeling? Pretty good sense of it at this point in terms of how the coding works. Well, I shouldn't say pretty good sense of it, but you feel like the basics of it are fairly there for you?
So at a point she said, if I can get this right, and then she said something and I coded that as summaries. I don't know if I did it right.
Let me see if I can see what you've just said, I think she says, right? Is that what you mean, Janet?
Yeah.
Yeah. So yeah, I coded that as a summary as well. And yeah, he interrupts that a couple of times, but she's basically summarizing his previous utterance. And I think she's breaking in, she actually interrupts him to do that because he's kind of running away with the conversation at that point. And so she wants to kind of, okay, let's bring this back together. And then she summarizes and he's like, yeah, that's right. And then that was shortly before this point in the conversation, I think. Yeah, so yeah, good call there. I would say that was a summary. All right. So if you're open to it, what I would like to do, and I'll stop share for a sec and get us back on the main page here, is start to look at breaking into groups, and that'll be groups of 3, and it'll be going according to 3 roles in each group, and I'm going to walk through those. Once we break into those rooms, we're going to start the practice piece. So let me walk you through the different roles, which will mean I will go back to the slides. And let me minimize that, and this, and that, and this. So you should be able to see the practice speaker slide up. Is that right? Okay, good. So one of the 3 roles, because if you're going to do MI, you need someone to practice it on, is that one of the people in your group will need to be the speaker. And you'll have a chance to do all 3 roles, assuming the time doesn't get away from us. So hopefully we'll be able to rotate all the way through. The speaker's job is to talk about something. And this is where your health self-assessment sheet might come in handy. If you have that available and you want to pull that up, it's just a tool to use to kind of rate yourself in terms of your satisfaction with your behavior patterns on those specific areas. And I believe there are 8 of them. If you need that sheet, it's actually in the chat right now. So you've got that available to you. Just pop into the chat. You can download it. Jacob just popped it in there. Thanks, Jacob. And it gives you those 8 areas to look at. So you can look at that and say, okay, which of these, could I really do better with? Would I like to get better at? So take a look at that. And if none of those are appealing in terms of something to talk about, you can talk about whatever else you want. Just something that you could make a decision about, that you have some ambivalence about, and that you're comfortable talking about. Preferably something that's real for you. We find role playing, people tend to get caught up in their roles and it's not as helpful. Plus, there's something about being on the receiving end of this that's very interesting to a lot of folks, and it'd be good to be able to experience that. So that's the speaker role. So start to think about that. What could you talk about? Second role is the helper. So the helper's job is to do MI, right? Use the spirit and skills of motivational interviewing. Try to use partnership, acceptance, compassion, draw from the person. You want to be using, if you can, twice as many reflections as questions. Very hard out of the gate, but do your best. Do not try to fix the problem. Remember, you're just trying to explore, right? You're just painting the picture with the person. So try to get as full an image of what's going on with the person as you can in the time that you have. Don't worry about talking right away when the person pauses. Think about what you want to say. and then put out there, you know, what you're comfortable with. But try to reflect as much as you can. If you're saying something and you don't like it, just discard it and say something else. Take a do-over. That's perfectly fine. Gotcha. So that's the helper role. Coder role is to use the order sheet that you were just working with. You can either move to a different section of it or just erase the input that you have there already. And your job is to assess the helper. So you're counting their behaviors just like you were counting Terry's behaviors a few minutes ago. And then we'll use that information when we do feedback. So when we're ready, which will be in a couple minutes, I'm going to have Jacob pop us all into breakout rooms. I'll stop the share there for a second so we can see everybody. So we're going to all pop into breakout rooms, and there's like 16 of us, so there'll probably be like 5 rooms. There'll be about 3 people in each room. I do want to take a minute, check in with folks. I see from Nate that his internet connection is unstable. So he is not thinking that he can engage in the practice. So Jacob, what we'll do is we'll add Nate to a room, but we'll kind of have him sort of in an observer role. So he could be like a 4th person in a room. You'll find Jacob, you probably already know this, but you can move people around as you like when you're the host. But as much as possible, we want to be having our video on at this point, and we'll obviously unmute ourselves in the breakout room so we can have the conversation. So let me just check in with Jennifer, Denisel, and Priscilla, and the other 2, which are Kay, Shay, and Alves A. Could each of you unmute and just confirm that you're still here so that we can include you in a group?
Hi, this is Denisel speaking. I'm still here.
Thanks, Denisel. Excellent.
Yeah, this is Priscilla. I'm still here.
Priscilla's there.
Is my video not showing?
Jennifer's there. You know, your picture is not showing.
Oh, I'm sorry.
Oh, no problem. No problem.
Oh, my bad. There you go.
Oh, there, yeah, we can see the side of you. No, then that's fine.
Because I'm using 2 screens. I'm using my laptop, but then I have a bigger screen.
Oh, okay.
That I used to see. So I'm sorry.
Is your laptop either Kay, Shay, or Alves A?
Hi, this is Alicia.
Oh, hi, Alicia. Okay, so Kay Shay, it looks like, is not actually here. That might be Priscilla's laptop. I don't know. So Jacob will leave. Actually, we'll put Kay Shay in Priscilla's group, and everyone else will break out separately.
No, excuse me.
It's just you.
My laptop is the original machine. The other one is just a screen.
Oh, it's plugged into the screen. I got you.
Yeah.
All right,
yeah.
So we may just leave
Like
Kay Shay out in case that, unless that person shows up, in which case you can pop them in as a 4th. All right, so what we'll do. How long, Bob? What's that? Oh, yeah. How long? So we'll do a 10-minute conversation. So Jacob will pop us into the rooms. He'll wait 9 minutes, and then he'll put a timer up that will tell us there's a minute left. If you're the helper, once you see the timer, that's probably your cue to move into a summary, right? And then we'll pop back out, and then we'll have a brief conversation about how you do the feedback. So we'll be in for 10 minutes, and then we'll be back out again. Make sense? All right. Okay, Jacob, whenever you're ready. So I got to say, I'm thrilled about that, just because I usually get cut off mid-sentence when the thing ends, and I had just finished a sentence, and then it ended. That was, for me, that was a win. So I want to check in with folks on that conversation, but I want to wait until after the feedback piece. We're about to go back into the same rooms, and this is the time for the coders to give feedback to the helpers. So if you were the coder in that conversation, this is your chance to give feedback to the helper. I'd like us, though, to do it in a way that's consistent with motivational interviewing. So if you could, begin by asking the question to the helper, what do you feel like you did well? So that way we're both being strengths-based, right? And we're also listening from the person. What does the helper feel like they did well? And reflect their responses. And so what else do you think you did well? Reflect those responses. If there's anything you want to add that they did well, ask permission to add that. There was something else I noticed, you might say. Could I share that with you? And they will say yes, because they want your positive feedback. And then at that point, after you've done that, you can switch to, what would you like to do better next time? So these are the stretch goals, right? And then get their responses, reflect those. If you want to add something, ask permission to do that. And that's basically it. We'll take about 5 minutes for that. There'll be 4 minutes, and then Jacob will give us the 1-minute timer so you guys can wrap things up. And then we'll be back in the main room. Sound good? All right, off to the races. Welcome back. So let's check in about that real quick, if we could. Any thoughts, any experiences to share? Don't want to hear the content of your conversations, because that's private. But in terms of what you observed, how the process went, anything that surprised you, either with the feedback or with the conversation itself.
For you, it seems real easy for you to come up with questions. And for me, it is more difficult in the moment to sometimes come up with an appropriate question or reflection.
Because it is something that takes a good deal of practice, and as we've said, it does get better with time. But yeah, so Barbara was in my group and I was the helper. And if it's any comfort, it probably took me 6 months since the first time I learned motivational interviewing to feel even a little bit comfortable with it as an interactional style. And that was back in 2006, 2007 at this point. So my ability to do that is really kind of born out of a lot of coaching and a lot of practice. And that's what, again, is in front of us for you if you do decide to go that direction. You know, the benefits are there. It's a matter of, is this something that's worth it for you? And for most folks I've talked to, there does seem to be some value in it. But yeah, it does get better with time. Other thoughts or Raquel?
So what I want to share is that, you know, something that I feel preventing me from doing something better was that, first of all, the topic that we were discussing, that was exactly my topic to begin with. So it's interesting because in the moment, I'm aware that I'm not the one in the session, I'm the one who's listening.
Yeah.
But it was very hard for me to stop and say, it's not you, it's about her.
Yeah.
That to begin with. And then the other situation is that it's safer for me to ask questions rather than allow the other person, because like that gave me a little bit of anxiety. What if she said something that I don't know how to approach, or what if I'm going to say something stupid and that's it, it's a problem because I stopped listening right there. Or I even stopped myself. I said like, oh, wait a second, I'm thinking a question.
Yeah, yeah.
So thinking. So instead of like listening, I was thinking.
Right.
What to say, how to say it.
And it's a distraction.
Yes, and then there's a coder.
You're kind of
like,
in your own head.
Yeah, what if I'm saying something stupid, or oh no, it's wait, reflection. And then all of a sudden the time was off. I'm like, oh, okay.
So I saw a lot of nodding, Raquel, when you were talking. So for a lot of folks, A, not easy, and B, certainly a stretch, and C, if the topic happens to be something that really hits close to home for you, then suddenly it's another layer more difficult because you're having to really separate yourself from it and try to maintain this isn't about me, and I don't want to kind of go into sort of a joining thing. Oh yeah, that happened to me too, because I'm supposed to be practicing this where I'm focused on them, not on me. And then all that's run through your head and you're thinking, oh, am I even still listening to this person? So one, I think probably the best I can do is just a small piece of reassurance about that. The experience of pretty much every speaker I've talked to, whenever the helper says, I don't feel like I was listening as well as I could have been because I kept overthinking what the person was saying. When that happens live, I do love that, because my usual tactic is I point to the speaker in their conversation and I say, was it your impression that she wasn't listening to you and that she was too stuck in her own head? And 100% of the time, the speaker says, no, I felt like she was really engaged with me. Now, step back and think about this for a second. What you're in your own head about is that you are really focusing on what she said. That's listening. And it's just that we're not used to thinking of listening as, okay, I'm taking this, I'm trying to think about what can I say that's going to be helpful and responsive. What you're focused on really is processing what the person has said to you and how you can best be helpful to them. And the speaker realizes that, and they appreciate it, because what you're doing, far from it not being listening, is you're listening harder, in a sense, right? You're actually more focused in that sense than a lot of times we are in conversation, because, I mean, frankly, let's be honest, we tend to be very distracted a lot of the time. And I'm guiltier of that than most people. I often, find my mind wandering a bit during conversation, but less so when I'm doing MI, because I have to be so focused. So for me, it actually, if we learn to think about it that way, it can actually be more of an aid to focus and concentration, if we let ourselves off the hook a little bit. Hopefully that's helpful. Other thoughts or experiences in that round?
I have a question. This is Carol.
Hi, Carol.
So one of the things I was very struck by in the video with the smoker, was the pace of that.
Yes.
So one of the things, I mean, I think the pace was partly his.
Yeah.
It was also hers.
Yeah.
So when I watched that the first time, when we were watching it through the first time, I was like, wow, I can really see how this is Mount Everest to be able to respond that quickly.
Yeah.
So then in our session, we also had this kind of invisible clock, and I felt like there wasn't really a lot of space, even for the helper to kind of process. And is there, you've spoken about the fact that, when someone's kind of getting in their head, they may lose track of things. Is there space for pausing or processing, and does that interrupt something that's valuable?
Carol, a beautiful question. And so two things. Yes, Richard is chatty and very talkative and very fast, and he's quick on his feet, mentally speaking. And he's rapid fire. And Terry is a genius and matches pace with him, and that's partly by design, but she's also been doing MI since it was developed and is one of the world's premier researchers and clinicians in motivational interviewing. I would not go up against her for all the tea in China, because she would mop the floor with me, and frankly, I'm a little, frankly terrified of her. For other reasons, but we'll put that piece aside. Yes, the pace is really the persons and the helpers, and that needs to be sacred. Where the pace you move at it's got to be comfortable for you, and it is absolutely fine, acceptable, desirable to say, let me think about that for a minute. And I encourage people to do that for two reasons. First of all, because we should be able to think about it for a minute. And secondly, because the person coming to us with whatever problem they're struggling with, if we just kind of go right to, if we're rapid fire and quickly get to a solution, what that communicates to them about their own abilities and what we might think about those abilities is not something that I really care to communicate to them. So I am wanting to be very willing to say, let me think about that for a minute. Whenever I even feel like it, just to kind of slow the conversation down so that they can also see this professional who's been doing this for so long is stumped by my question, is stumped by my problem. No wonder I'm stumped by it. It's not that I'm not capable, it's that this is a hard problem. And so that kind of shared stumpiness, I'm not really satisfied with that word, but you get the idea, kind of is itself an affirmation to the person. Make that sense? Does that make sense? Yeah.
I'm really glad to hear that because I was the helper and there was some pauses, some pregnant pauses, and I was like, I felt anxious, like I've got to ask a question, but it would be nice to, I was thinking like that last video, I needed to be rapid fire.
Pace yourself, pace yourself. Yeah. That slide with the helper slide that we just had up, take your time was one of the bullet points. Let yourself just develop what you want to say and then say it up there. If you want to pause the speaker, say, give me a sec. And then come out with what you think is going to be helpful. So we're starting to run short of time and I want to kind of get us back onto track. If we could pop back into the conversational groups, this time we'll do the 10 minutes and at the 10-minute mark, Jacob will send us a message in the rooms to switch over to feedback. And at that point, when you see that message, close the conversation off and then the coders can then do feedback for the helper, just like we just did. So we won't have the break in the middle like we did the first time. That makes sense?
Are we switching roles?
Switching roles, absolutely. Rotate the roles. So do something different than you did before. We want to make sure that we can get as many chances around as we can. We're probably going to run short of time before we get all the way through this, but all we can do is our best, right? So another 10-minute conversation coming at you. Jacob, as soon as you're ready.
Bob, how long for feedback?
Okay. Hey, everybody. Welcome back to the main room. We just have about 5 minutes left. So the bad news or good news, depending on your perspective, if you were about to be in the helper role and you're like, dodged a bullet, then good news for you if you were eager to be in the next role that you're going to be in. I apologize. We will be doing more practice. We'll be doing practice each of the half days in the next sessions. And there'll be slightly longer sessions as well. So this will gel more for most of us as we continue to practice with it. I encourage you in the time between now and then to play with this, right? Try some reflection out, especially complex reflection, and see kind of what happens in your conversations, whether it's in your personal life with your loved ones or whoever else you happen to be quarantined with in this bizarre experience we're all going through. Or whether it's in your professional roles with colleagues or with your clientele, however you can. I encourage you to just trot it out, see what you can do with it, have some fun with it. There are a lot of resources online. If you're interested in doing some reading about this, University of New Mexico has some wonderful resources on MI. Happens to be where Bill Miller used to work. Terry Moyers is still there. So they've got a lot of stuff. There are videos on YouTube. The quality on the YouTube videos is hit or miss. Certain people are fantastic. Alan Lyme is great. Alan with one L and Lyme like the disease, which is not how he likes me to say it, but is in fact the case. And Lisa Merlo is another one that I like. Merlo like the wine, except it doesn't end in a T, I don't think. I like her. She asks more questions than I like, but she does a lot of reflecting as well. So plenty of content there if you want to kind of look at things. In the late June sessions, we'll be focused, as I said before, on the strategies. So we'll be doing the spirit and skills, and then also thinking about, all right, where are we going with the conversation? So if you're in these conversations we just did, and you're thinking, all right, but how do I move this ahead? That's what we're doing in a few weeks. That's the strategic part, right? So we're going to be, we'll hit the ground running with that in, I guess 3 weeks from now. Looking forward to that. Thoughts and feedback on that round of conversation. What did you experience? Any input or feedback that you want to share?
I felt very comfortable talking about a delicate topic. I think the person who was the helper did a really great job putting me at ease.
Excellent, excellent. We didn't actually watch the Richard conversation all the way through, but one thing that I like to show people a lot is that he gets debriefed at the end of the conversation with Terry. He talks to Bill Miller for a little bit. And at the end, Bill Miller thanks him for having the conversation with Terry. And Richard says, thank you, I enjoyed it. And for me, that's where the money is, right? A smoker is saying that he enjoyed a conversation about smoking. And that's just not something that happens a lot. And that's, if we can just have conversations where people feel comfortable, we're not judging them, we're inviting them to open up, we're inviting them to share with us, and we're looking to really understand where they're coming from, that goes places. That's got legs. And that's where we see a lot of the success with this model, is just that openness and willingness to listen and not judge and just be empathic with. And how much, oh my goodness, does our world and especially our country right now need people to be empathic with each other, right? So we're just about 4 o'clock. And I want to respect people's time. So I'm going to close this at this point. Please stay safe out there, stay healthy, and hopefully we'll see you again in a few weeks. You will be getting an evaluation. Within about probably 24 hours at this point, you'll receive from our administrative coordinator at Job Consulting an evaluation form. If you could fill that out, send that back to us. And there's a space for your name because we're not allowed really to do anonymous feedback. It's a CE requirement, and we're working towards CEs. And we'll use that name that you give us to make your certificate with. So make sure you put your full name as you want it to be in your certificate on that form. It's a Word document. So just open it up, edit it, and then send it back to us. If you have any problems, just email Linda, the one who emails it to you, and she'll help you out with that. And then we'll use that to generate the certificates. Any last questions or thoughts before we close?
What date is the next session?
Next sessions, and Jacob, if you get there first, feel free. There we go. So the 22nd and 24th of June, that's a Monday and a Wednesday. So 2 weeks from this Monday is the next set, is part 1, and then part 2 on the Wednesday. Same format as this one. It's part 1 on both morning and afternoon session on the Monday, part 2 morning, afternoon on the Wednesday. So you'll take either one, one or the other at each time. Mix and
Do we
match.
have to register again, or are we automatically registered?
I think it'll be you have to register again. Is that right, Jacob?
Yeah, we're going to send out an email with a link probably next week at some point.
Okay. Thank you.
I just
And
wanna
these
say
recordings will
thank
be
you.
posted.
The class really surpasses my expectations.
Oh, thank you, Raquel. Thank you.
Yeah, it's really, really good.
I'm glad you're finding it helpful. I obviously I'm enjoying myself, and you guys have been a blast to work with, and I look forward to seeing you again in a couple of weeks.
Thank you.
Next time I want